Good day and welcome to the Herbert Dennard Show. We have with us Julie.Williams, RN. How are you doing?
I'm doing fine. How are you?
And RN is not a name, that's her profession. She's from the Coliseum
Northside Hospital.
Northside Hospital. Coliseum owns two hospitals in the area.
It does. It can get a bit confusing. Coliseum Northside used to be Chartered Northside. I believe that's how it started. And then it got to be Macon Northside, and now it's Coliseum Northside. It was acquired by HCA several years ago, and so they finally decided to change the name to Coliseum Northside. So there's two in Macon: Coliseum Medical Center, which is the big hospital downtown, and then Coliseum Northside Hospital, which is off of Forsyth.
Coliseum Northside recently are doing something different. What are they doing now?
We've started an orthopedic program there.
Orthopedic, what is that?
Orthopedic it's basically bone surgery.
Bone surgery, okay.
Yeah, and as you can imagine, somebody that needs bone surgery has a hard time moving around. And Coliseum Northside is a great place to have that surgery because it's very easy to get to. It's a smaller hospital compared to some of the hospitals in town, and it's a lot easier to navigate if you've got to have some sort of bone surgery. It's a really nice place to go. It's a good alternative.
What are some of the bone surgeries that we have?
We do total knees and total hip. Those are probably the two most common for our older population today.
Total knee. What is total knee?
What that means is somebody that's got severe arthritis. That's where your bones, basically what's happened is this nice cushy tissue in your knee or in your hip is basically worn away, and it becomes very painful to walk, and you can get some swelling and just a lot of pain. So what we do is we go in and modify the knee, basically, smooth out the bone and put back in something that acts like cartilage to make your knee more comfortable to walk on.
Some cushion kind of stuff.
Yeah, it's basically like plastic.
Together.
Exactly. And what keeps that in place is some metal. Most commonly we use titanium. Technology's changing every day, but titanium is one of the most common. And one of the most common questions is, can I set off the metal detector at the airport? And some people do, and some people don't. It depends on which implant the surgeon has chosen to put in your knee or hip. And basically, you just have to know you have to travel with your medical papers everywhere you go in case you set off that detector.
What about hip replacement? What is that?
Hip replacement's pretty much the same. It's you replace your ball and socket. That's what a lot of people know the hip as. It's similar to the knee. It's a hinge joint, and basically the same thing has happened where you've had that nice cushy tissue in there worn away, and you need to get in there to smooth things out and make it more comfortable for your hip to move in a normal way again.
I know it's not sandpaper, but you use something like sandpaper to smooth it over?
Not really. Not really.
Okay. Tell me how it really is then.
There's a lot of instruments that we use. I don't know how much detail. I don't want to be too gory, but basically we take out the bone that's in there in your hip, the ball of your bone, of the ball and socket. We actually remove it and put in what we call a femoral head, and that is it's a big ball, and hence the name ball and socket. So yeah, there's a lot of.
Is the ball metal?
It can be.
Okay.
Like I said,
something else.
The technology's changing. It's mostly metal. Yeah, that's the easiest answer for you. Some surgeons choose some different types, but basically, yeah, it's metal.
Use some of that surgery type.
Well, it depends on the patient. There's several different types of procedures we can do to the hip. If somebody just has a hip fracture, we can do something called an Austin Moore or a bipolar procedure. And again, I'm not a surgeon, so I can't go into too much.
Things.
Yeah.
But either way, you take the knee, the hip, and other kind of bone surgeries, you can do it at Northside now.
Right, exactly. Even if you need just a knee scope, sometimes you don't know what's happening to your knee. You may just have a little knee pain, and technology is to the point now where they don't have to cut your knee wide open. They can make a tiny incision and put a camera in there and see what's going on.
Pretty small camera.
It's very tiny.
kindly
tiny.
used on 24.
Yes.
That's good.
Yes.
But so how long have you guys been doing this?
We've been doing it for many, many years. There are a couple of groups of surgeons that have been there a long time, but the hospital's never been that busy, and it's never attracted a lot of the orthopedic surgeons in town. It's just attracted a couple of the surgeons in town. But as the population is growing and the number of orthopedic surgeries is growing, the orthopedic surgeons need another place to do orthopedic surgery. They're basically busting at the seams, and Macon is blessed to have an incredible group of surgeons in town. We have several different groups, and all of them are very talented, and so we just need another place to operate.
Years ago, I never heard of anybody having hip replacements and knee replacement. Now I'm hearing about it all the time. Was the people living in pain?
People were living in pain, but I think why we're hearing about it so much more now is the baby boomer population is now to the point where they're starting to have knee and hip replacements. So that's, I think, why we're hearing so much more about it, because it's so much more common. Yeah.
Appreciate you stopping by.
Sure. Thank you.
Georgia.Williams, RN.
Yes.
Northside.
Yes.
Appreciate you.
Thank you, Herbert.
Got to come back again.
Yes, I'd love to.
We'll be right back.